Hi everybody, I want to go over a technique that you can use to try to reduce some of the pain in your knee. And we're going to go over particularly one for the lateral knee. So sometimes people have IT band type symptoms or pain more diffusely across the outside of their knee. So we're going to show you a technique that you can use for that. There's a couple different ways of doing this. We suggest you try and see which one feels best. Start by just doing something like a squat, either 2 legs or single legs, and see if that recreates some of your pain. And then what we're going to do is we're going to use something called voodoo floss. Now, you can buy this from Amazon. It's a pretty thick piece of rubber, but you can also use things like bike tubes or long pieces of TheraBand at home. Just something that you can wrap pretty tight, not too tight, it's not a tourniquet, but wrap pretty tight. So when you're wrapping it, you're going to start, if you see how I have it here, I am going from the underside of it so that I can keep some tension on while I'm going, because it's important to get tension. You're going to start with the piece of band on the inside of your knee. And for this first technique, you're going to go around just light pressure on the back of the knee. Then you're going to wrap on a diagonal and get more of a pull from there, so that it kind of forms right across where you're having some of the pain at the end of your knee. Then again, loosely around the back of the knee, and then pull tightly and move downward so that it creates an X of where you just came up. Then you're going to wrap again around, and you're going to keep forming that X pattern by going up and then gently around the back. And you'll form an X with just however long of a band that you have there, so that the kneecap is still exposed. You're not really on that, but you get a nice pull there, and then a little gentle on the back. Good. And then when you come to the end, you can just tuck that in so that that's now on nice and secure. You can see that from the side, that there's an X right at the outside of the knee. And then do the activity that was painful for you. It might be standing up from a chair. It might just be doing some squats. And this is going to be, we're going to have you do this, even walk around a little bit with this on, just so that you can have that increased input on the outside of the leg. And then after you've done a few, you'll go ahead and take it off and observe if you see a difference. Now, while I'm kind of preparing to show you the next technique, just a little thing about why this helps. There's a few theories about it, but one of the biggest things is actually giving more awareness of your knee for your brain. So the increased compression gets your brain to really focus on that area. There are some potential benefits from compression and a little bit of the pressure from the band, but a lot of it is actually teaching your body to pay attention to that body part when you're actually doing an activity, so that you're learning how to have proper mechanics. So that's one of the benefits, and why you might use this as an alternative to something like foam rolling, because we want to not only just relieve the pain temporarily, we want to teach you how to move correctly. So another way, one of the ways I've commonly used it is people will have the pain distally at the knee, but they'll sometimes have it more mid-thigh, up around the vastus lateralis and the IT band up here. So if you're having pain up there, you can do another type of wrap, simply where you're just doing circular wraps here. And again, I like to go a little bit on a diagonal with it, not straight around here. So just kind of forming like little mini X's where they cross over each other. I found that technique to be helpful, but you're just going to layer it around and wrap it around as you go. And then, get it pretty tight and pretty snug. Then when you reach the end, you'll just tuck that in and do the same thing. And you'll then now go ahead and just do the same thing again. It's giving a little bit more awareness, a little bit more compression. You're focusing on the knee, so make sure that you're having good technique as you go through it. You can do the same thing, wrapping it just around the whole knee if you're having more anterior knee pain, or you can put it distal to the knee, and this is a great technique for you to try and see if you can get some relief, but also work towards long-term success with lateral knee pain.